Today on Discerning Elephant, dial 988. That's right. It's the federal government's new mental health crisis hotline number. This number spans across the United States as the alternative to 911 for people experiencing mental health emergencies. Also on today's show, Discerning Elephant is going beyond the U.S. border all the way to Nigeria to discuss in modern healthcare law on how to assist those suffering from mental illness and substance abuse that got people wondering about its implementation and sustainability. But first, joining me on Discerning Elephant's public health panel are Adina Otoho, Alex Sheehan, and Udo Anaba. Welcome to Discerning Elephant. Alex, what is 988? What is this thing that's going on?
So 988 is a project, a very multi-collaborative project that's been worked on for a long time. And it's essentially replacing 911 as the US's new 3-digit dialing code that will automatically route individual callers to the National Suicide Prevention Lifeline. And I believe they're actually now known as the 988 Crisis and Suicide Lifeline. That's now active across the US. And so again, when people call, when they text, or just want to chat at 988, they'll be connected with various trained counselors that are part of that larger Lifeline network. And these counselors are trained to help understand, discern, listen, and help evaluate, the issues, problems, illnesses, difficulties that are, detrimentally impacting them, as well as also providing support, advocacy, and connecting them to any local resources if possible. Overall, the Lifeline, I believe, has over 150 crisis centers, or 200, something like that, prior to 988 that have been active since the mid 2000s. And they've really been proven to be effective in, providing this kind of short-term psychological reprieve and, access and navigation to resources. And so it's a absolute game changer to how the US is going to be helping handle and battle its mental and behavioral health crisis across the nation.
Is 988 also available for substance use crises, or is it just for suicide-related crises?
So it's really, those two are so interchangeable. I don't know if it's directly related to, or for substance, it's not directly for substance use, but because substance use is usually a determinant or an exacerbating factor of mental illness, it's a vicious cycle that can cause co-occurring disorders if utilizing substances long enough. But it is definitely going to be another resource, another tool in the belt to help combat these issues.
Nice.
Another thing I would like to add there is there's no minimum age to reach out to the hotline, and you can receive emotional support at any time, even on holidays. As long as you have a phone, you can just call the number and talk to someone, which is really something that is going to promote access to, mental health care for people.
How often is 988 numbers calls referred to 911? Is there like a switchboard do they need to qualify if it requires a 911 call? Are they working interchangeably, or are they kind of like as standalones?
They're designated to be their own standalone. So you can literally just straight up dial 988 and you will be connected to a trained counselor. Now, it depends on the state, because every state has their own, healthcare authorities or some kind of state level entity that's helping implement 988 within their respective states or larger geographical regions. So for Oregon example, I believe it's done by the Oregon Health Authority. Here in Washington, implementation is of 988 falls on the Washington State Healthcare Authority and so on. So every state will have their respective governing body that's ultimately helping do that, so that, you know, the national government's not doing that all themselves. It's best left to the states who know their individuals, who know the statistics, who've done the studies, and know what's really impacting their areas. So
is the federal government requiring different state leaders, whoever's the administrator of the 988 number, to actually meet like once a year to talk about like best practices, to make sure that everybody's kind of streamlined and everything is the same? Or is it just kind of everybody just do their own thing and there's like no feedback loops?
Oh, I'm more than certain. I don't know for certain, like exactly what they're doing via like a steering committee or you know, some kind of a you know, official capacity like a governing board or advisory board, but I am more than certain that they have a federal government like way helping circumnavigate the states and back and forth. So
Udo, what's your thoughts on the 988 number?
Well, I think it's you know, quite interesting because you know, in certain places, for example, here in Louisiana, in New Orleans specifically, you know, we have like the local campus health or Louisiana you know, health authority. We have a particular number, not necessarily 988, you know, but like a particular number where you call for direct mental health care services. So there is a faster response through that channel. So while 988 is very important, there are also like other numbers where you can like call for quick and immediate care, especially within those living in a particular location. So we have a different number, and then we call that to actually, you know, respond to mental health emergencies.
Can you call, and could you like text and have chats as well instead of actually calling 988, or does it have to be a phone call?
Not on 988, but basically there is this like telehealth option too. And I think that's a very important part of the mental health. In fact, it's one of the things that has been suggested to also improve the US mental health care system by incorporating telehealth and also like integrating like the mental health care system into primary health care system. So I think that telehealth part is very, very important, especially when people do not have access to physically come in for mental health services.
Just to touch base, yeah, so 988 will have or does have a text option as well. So, you know, there I've heard, you know, success stories of my, you know, through my employer of individuals who've been working on 988 implementation here in Washington. And I've heard, you know, success stories, but stories of individuals who stated that they loved the text option because they could be in a public place and they don't feel comfortable sharing that in public where people around them are going to be able to hear. You get side-eyed. Mental health is already stigmatizing without people having to worry about that. So a text option is another way of kind of removing that layer and providing more comfort and truly meeting people where they're at by giving them another option to be able to convene or you know, chat with trained counselors or individuals about what's going on in their lives, especially if they need it right here and now. So that text option is absolutely crucial.
As far as the outreach is concerned, who's supposed to be responsible for making sure that that number 988 is a staple to the community and all 50 states as the designated number to call instead of 911 when people are in tragedy? Because I live in California and I have not even heard or seen billboards or anything about 988 at all.
And that one is a hard question, especially because there is still quite a lot of people, organizations that aren't aware of 988. By now that it's over the 50% threshold of individuals in the United States that know what it is and how to use it and what its intent is. But there is still, I do know, and again, through where it's being worked on in my own individual state, have heard stories and experiences from individuals who reportedly called that didn't know who to call based on what was going on in the situation, especially if it's a situation regarding a family member, because 988, it's not just for the individual who they themselves is, needing, help or assistance with a mental health emergency, but it can also be used for family members as well. So if I have a family member that's experiencing immediate crisis and they're not in a place where they can call, they can call on their behalf as well. And kind of when you start bringing in other people, from what I've heard, just it's kind of difficult right now knowing where and when to call 911 versus 988. Obviously, 911, tells you we've been so dialed into, call 911 if this is a medical emergency. But when you're having a mental health crisis, that's hard because the brain controls the body, the mental controls the physical. So how do they know to draw that line? And so there are still a lot of interchangeable, calling 911 when they probably was best to 988 and vice versa. But I feel like that's going to be a long-standing challenge that probably won't go away anytime soon. But it is nice just overall that there is 988, a completely standalone designated 3-digit number for individuals struggling with and needing, help or assistance with a mental health emergency.
Yeah. And before we go to break, I do want to ask, is about competency. Like, are the 988 operators or counselors, are they trained? Or do they have cultural competency? Like, are they going to be able to really, ascertain or kind of acquiesce to the request that's coming before them? If I'm Asian and I need to speak Chinese or Mandarin, if I'm Spanish and I need, I'm having real issues about, struggles about, I don't know, whatever it can be, drugs and having suicide thoughts. Who's responsible for the training piece and the competency? Like who gauges that and who's administering that process?
I'm not sure as far as like who's directly responsible, because again, I think that's going to be something that's left over to the states, and forgive me if I'm wrong on that after researching, but I do know that with the creation, development, and implementation of 988, that a lot of work is being done and has been done already prior to launch that, brings about and considers, all the different, determinants of health and like things that normally inhibit individuals' access to care, especially, culturally, linguistically, especially when we're speaking about, different language and, just the inclusivity and equity in it, I know has been definitely considered as they've done this.
It's interesting because President Donald Trump signed this bipartisan bill to establish 988 as a national number back in October 2020, and many people haven't heard about this, and maybe this is something that people don't really contribute to his success, or I guess it was the legislator more than anything. But I think there's more to be said about this, because I'm really curious. After we take this break, we're going to come back and we're going to take a break real quick. When we come back, we're going to discuss the funding, who's funding this, what's working and what's not working. We'll be right back.
This episode of the Discerning Elephant podcast was sponsored in part by UL, also known as the United Educators of Housing and Literacy. Their mission is to bring awareness of reading scores of Black youth throughout the San Francisco Bay Area, to educate parents, teachers, and community leaders on literacy instruction, and to support basic allowances for housing for teachers, one community at a time. If that's a mission that you can support, then please visit UL online at www.uehl.org for more information. Thank you, UL. We appreciate everything you do.
Hi, welcome back to Discerning Elephant. Again, we have Adima here with us, Udo, and Alex. We're going to go back to what we're talking about, and that's 988. We're going to talk about funding, who's funding this, what's working, and what's not working. Adima, what's going on with this funding? Who's funding this?
So the U.S. Department of Health and Human Services is funding this, and like Alex had mentioned earlier, we have the states and local centers across the country that are supporting this whole initiative. But something I'm not really clear about is why there's no much publicity around the 988. A lot of people don't know about it, and I've been trying to wrap my head around why so much work has been put into setting up such a nice structure, then not much work has been put into publicizing it. So,
Alex, what's your thoughts on that?
I don't know why there hasn't been like more 988 advertisement. I mean, I myself, being in the mental health field, know about it because I follow and work with and, work in mental health policy. But for, those that don't, those that work in construction, those that work blue collar jobs, those that, don't watch a lot of TV or spend time on social media where you might see it everywhere. I don't know what strategies have been implemented, for that, but I do know that, that is something that needs to be done. We're in a digital age now, and we have a way to pretty much reach everybody at any one time. And it's just important to stress, the need and for 988. And even if that looks like you said, Azalea, you didn't even know that it was operational until we kind of had, the conversations about this episode, this dialogue, and California's a big state. So to know that even working for in a major metropolitan area within metropolitan government and not knowing about it yet, does say something about, has the government, the federal government, I don't want to say failed, but could advertisement of this have been better? I'm sure it could have, but like I said, it's still very new. 988 only came out in July, mid-July, so it's only 7 months old, give or take, a few days, and so it's going to take time. But what is nice to know is that the individuals working, tirelessly across 200 plus crisis centers across the U.S. to enable this, are really trying to, steer us forward into, destigmatizing mental health and helping people get help for it, especially in a time that's post-COVID. In 2020, I think the National Suicide, I can't remember the name of the organization, but there was essentially one death every roughly 11 and a half to 12 minutes. In 2021, for people that were age 10 to 14, or I believe 25 to 33, 34, suicide was the second leading cause of death. And that's, those are just some of the statistics. I know that over 1 million youth between, you're talking 11 and 17, prepubescent teenagers, all the way to just, you're not even an adult at 17, and over 1.5 or 1.6 million attempted suicide. Those are staggering numbers, but it's because of 988 that we can drive that back. But I do know that with a project with something of this caliber, of this design, of this scale, there's over 300 million people in this country. And God knows how many of them, are, undiagnosed or just, experiencing any kind of emotional distress that they want to be able to call and talk out. It's going to take time. There's always going to be good with the bad, but it's just coming at it, I think, with just an optimistic and helpful, truly public health practicing approach, to 988 that, it's going to get better over time. It's going to take time, effort, energy, and the people who really care to, help us see a difference and continue to destigmatize mental health and, try to get help for those that are experiencing these types of emergencies.
Now, keep in mind, this is a bipartisan bill that passed in October 2020. We know that was underneath the Republican ticket. It was signed by the Republican president, a bipartisan bill. And we know that what happened in January 6th, right? That was just what in 2021. So could it be that this is like, is this politics as usual? Are we not going to see this to kind of rise up through the world of being a matter of contemporary policy because it was underneath slated under Donald Trump? Because we know in California, well, if you don't know, Gavin Newsom just signed Assembly Bill 988 on September 29th, 2022. And this just became a real big thing in California. I don't know what's going on in Louisiana. Udo, what's going on over in your town? Is it politics as usual? What's going on with 988?
Well, like I said, in Louisiana, there is not much news about 988, and like I like how we're talking about it now, but it's not common knowledge. So people still call 911 for emergencies, and I have never heard anywhere on the streets about 988. So I think there needs to be more publicity around it. And also one thing comes to mind, which is funding for mental health services. Just like Alex was, saying, we still have a long way to go. But Medicaid is one of the largest funders for mental health services in the United States. You can correct me. But in 2019, their 2019 data, mental health services received just 1.2% of Medicaid funding. So you see, we want more publicity. We want things to move forward. We want to improve the lives of people, and things like that. But at the same time, funding is the biggest problem. You see, funding is a big problem. And as Alex also said, stigma is another one. He mentioned we need to destigmatize, and that's a thread that connects everything. But in the US and outside the US, that stigma is one of the biggest challenges. So because of that, you might not even call 988, even if you know the number. So yeah.
Adima, you're going to say something?
I also think that addressing certain social determinants of mental health is also very important. We have some populations of people that are more vulnerable to developing conditions that, like mental health conditions. We need to pay attention to those groups more than others. For instance, people of color, we have maybe the LGBTQ community, we have low-income individuals, we have, different groups that are struggling with other social determinants like poverty, social isolation, different things, discrimination and the rest that we need to pay attention to be able to help them with mental health. And a lot of work needs to be put into prevention, because once we allow it to become severe, it becomes a lot more difficult to manage. So putting a lot of work in mental health screening and prevention services is actually a way to curb all of the huge effects of not having all of the structures in place. So that's what I wanted to just chip in there.
I like it. And wrapping this up, is there anything, what's working with 988? Even from your respective states, is there anything we can actually say that's working with 988?
Absolutely. 988, I know that in Washington State, there have been tens of thousands of calls to 988. And I don't know statistically speaking, but again, from, things I've heard, stories I've heard, and individuals working on it, what's working is just, providing more outlets. I guess, one of the single biggest things, providing yet another outlet, another way for individuals to be able to get help, regardless of the various social, political determinants of health that individuals face every day. Ones that Adima and Udo cited, everything from poverty, chronic homelessness or housing instability, lack of transportation just to get to an appointment. COVID, if anything good came out of that, was showing us that the inclusion of telehealth services and the ability to be able to utilize current technology to reach a counselor or just somebody to talk to 24/7, on a holiday at 3 a.m, whenever, wherever, as long as you have a phone, it's awesome. It's a good thing to see. And just knowing that, at least, one thing that keeps me going in, the mental health realm of public health is knowing that people are doing this work because they're truly, truly, truly passionate about it. We don't, I'm pretty sure people in public health can say, we don't do it for the paycheck. That's just for sure. But just knowing that you're around other individuals who are sharing their stories, or, their experiences with themselves or family, and using that to help individuals who are in crisis. It's wonderful. And a lot of them, are trained. Just, it could be little things that, could seem little, but aren't. Like, a big way of destigmatizing mental health is training these counselors who are responding via telephone, text. Could be as simple as using person first language. You put the person before the diagnosis. So saying, just like, I have a very good friend who has struggled with schizophrenia for quite a long time, and he used those services and told me, not being labeled as a schizophrenic, but as an individual, a human being with schizophrenia. And he's like, oh wow, that was like the first time I've ever heard that. And that got him to call back. And like, being seen as a human is very important in destigmatizing mental health, and is something that I think is just that inclusive, equitable principle alone is something that's really working with 988, and among many other things.
And to flip it, what's not working?
Before we get there, I would just like to add that just establishing this dedicated hotline for mental health just sends a good message that mental health is taken seriously, like other emergencies and, other diseases or illnesses, sorry. 988 is easy to remember. It's a dedicated line across the country, so you don't need to start cramming, a particular number for different states, which makes it easy to remember, and that's a good thing. But I really think there's a lot of work that needs to be done with the publicizing, like I said earlier, and so that more people would be able to use this service and, in an optimal manner. So that's where the gap is.
Do you want to take us into what's not working since you're on that topic about more outreach to get 988 more known? Udo, you want to take a stab at it? Alex, what's not working?
Yeah, it might not really be like, necessarily about 988 per se, because I think the thing about mental health, and also like having access to resources, is one of the things I would say is not working generally, like in mental health in here in the United States. Of course, United States is doing way better than many countries, is the prevention and early intervention. And that's the key, right? You don't want someone who has gone so far down the line, right? Because, they might not be able to like even communicate or be able to call or seek help, that's one. But specifically on 988, I think, like I said, like Edima also said, is the publicity. But publicity also involves money. We're talking about money. We're talking about funding, right?
That's the root cause.
That's the root cause. So
yes, money.
Yeah, exactly. So if there is sufficient funding, just like the data on funding we had, in fact, mental health funding generally, like in the United States, was 5.5%, thereabout, about 2020, thereabout 5% of all other services. So I think is actually the focus. Of course, cancer is, a big burden. Cardiovascular disease is a big burden. So, but there is even more attention than mental health. So mental health is like on the side, right? Mm-hmm. So 5% of all healthcare services funding goes to mental health. So with more funding, better funding, then we can now talk about more publicity, reaching more people. So we can't reach them because there are other factors that are limiting that.
I love it. I love it. I love it. So I mean, Alex, did you want to add anything to that about what's not working?
I just want to compare US with other countries when I'm looking at what's not really working with regards to mental health. A lot of countries have actually put a lot of money into the prevention side and also integrates mental health in their primary care services a lot more than how the US has done it. They focused more on community-based programs to increase access, especially to areas where there are lesser access to medical services in hospitals. So they've extended it to community-based care. I know US is doing it, right? But the magnitude of work that is put in compared to those other countries sets them back a bit because those ones have invested more in those community-based programs and also, the prevention part and the integration part of mental health in primary care settings. And some countries actually do universal healthcare coverage, including mental health. So
that integration into community-based care, primary care, is simply like when you go to the hospital, sometimes they naturally like check your blood pressure, they check, just your vital signs, just as a process. Why not check your mental health status? You know what I'm saying? So that's the point. Like it should be part of it. And in that way, like, we are talking about the prevention part of it, right? So that you can have access to early care, and also the early intervention. So if you're going down the path, so it should be integrated like as part of the process. So currently, one of the things that is not integrated is like it's a different whole like process, right? And then another problem is insurance. Most insurance doesn't really cover a lot of mental health, aspects or problems. So it's siloed. It's like, okay, your health, then mental health separate. So that integration is a key factor that will really kind of help. And also, I think it might also help as part of the destigmatization, right? Because it's just part of the routine procedures, not like, oh, you have to go here because you're having mental health issues. You know what I'm saying? It's just trying to incorporate it into routine care, which is the primary care we're talking about.
This is really, really good. I mean, 988 folks, get out there, learn more about 988. It's important. Spread the word. It's super duper important. When we come back from the break, Discerning Elephant is going to go beyond our borders. We're going to go all the way to Nigeria to learn about SB 66, a bill to protect people with mental health illness. We'll be back.
This episode of the Discerning Elephant podcast was sponsored in part by the Fair Housing Advocates of Northern California, also known as FANCY. Their mission is to ensure equal housing opportunities and to educate our communities on the value of diversity in our neighborhoods. Visit www.fairhousingnorcal.org to learn more about FANCY and their mission for housing equality. Thank you, FANCY.
Hi, everybody. Welcome back to Discerning Elephant. I swear, if you guys can hear what we talk about when we're at break, it's amazing. Alex just brought something up very valid about the notion between this whole battle between being reactive and proactive. Alex, give us a little bit about that. They need to hear about that because you made a very valid point, and Udo's on touch base on that as well as Adima. Please let people know about about this whole notion.
Yeah, so it was just built upon, what was spoken on by Udo and Adima that it's great that we have 988, and it took an ongoing devastating pandemic that took the lives of millions and, has altered the mental health state of millions more across not just the US, but the world. But, it took us being reactive for so long to realize that we need to be proactive in our work and how we approach really any area of public health, especially mental health. And just kind of that, while that's a national conversation, I just think that the entire field of public health needs to also continue to be elevated at that level, because public health is the protection and promotion of the health of individuals in the communities in which we live, we work, we learn, and we play. A doctor is going to be reactive because they're treating people who are already sick. They're treating you when you already have an illness, physical, mental, or otherwise. But then there's individuals working across different sectors of public health that are trying to prevent people and whole communities from getting sick or injured in the first place. And so we need to promote that kind of wellness and being proactive versus reactive and seeing where that gets us.
I really love this, and that brings it back to the point to Senate Bill 66 in Nigeria. Adima, what's going on with Senate Bill 66? Would you say that's proactive or reactionary? First of all, tell us what it is, and do you think Nigeria is heading in the right direction?
So at the beginning of this year, the president finally signed a mental health bill, and it's just something very significant because we've had the Lunacy Act, which was in place since 1916 and reviewed in 1968. And the bill didn't reflect, all of the learnings we've had around mental health globally. Before now, mental health wasn't really recognized, and there are certain misconceptions we had about mental health globally. But now that we've kind of learned and understood how to manage mental health generally across the world, it was time to actually change that bill. And with all of the efforts from advocates across the country, we finally got the bill signed. And it's very interesting because that's going to help us to have a significant switch. And also there's been some provisions for more funding for mental health, and having some systems in place, like having a department in the Ministry of Health that will be managing or providing the overall coordination for mental health across the country. And hopefully they would work with lots of partners, both locally and internationally, to see how to move this new bill forward and implement policies and initiatives to actually ensure that optimal mental health services are provided across the country.
In fact, to shine more light on what Adima has said, you won't appreciate the new mental health bill if you really understood what the Lunacy Act was all about, right? Since Lunacy Act of 1958. And it's from the word lunatic, it's derogatory, right? But it involved certain scenarios on ground. In the past, if you wanted to commit suicide, right, for example, and you were caught, part of the Lunacy Act was detention. You'll be arrested, right? Not necessarily linked to mental health care services, right? And also, there was a lot of stigma. You couldn't really talk about mental health. There were no real services, no trained professionals per se, no funding. So with all these things, mental health services were really poor. It's almost not talked about, right? So this mental health is like a breath of fresh air if you view where Nigeria has been coming from the Lunacy Act to this point. So it's just to shine more light on that. So it was like the dark times, and you see, we can use that to also appreciate, to see the US is also doing better in many ways, right? If you see what is happening in some other places, right? That's what I want to add.
And I also want to add that the Nigeria in Africa is very strategic, and making this move to, sign this bill can actually influence other countries Africa who haven't actually taken this bold step. So that visibility has been created around mental health. And I'm sure in the coming years, a lot more countries within Africa are going to take a bold step to see how they can move ahead with regards to mental health care.
Well, mental health in Nigeria has long been underfunded, right? That's always been an issue with the whole money thing. Where does the World Health Organization play into all this, if at all? I mean, I know that according to the World Health Organization, they report that they only represent 4.4 to 1% of the total government's health expenditure. That's pretty low.
Yeah.
Really low.
Mm-hmm. There are some initiatives that are running in silos, for mental health. It's not totally absent, but what this bill has done is to allow for a central and a more connected kind of arrangement for mental health services. So maybe smaller local organizations or international organizations have funded mental health in the past, but this is the first time it's really coming to limelight, and the government is the one taking charge and working with others to implement in a very coordinated and harmonized manner. So, yeah.
I think I just wanted to talk about this bill having to do with like the funding aspect you asked about.
Yeah.
About like more funding, and this whole prevention and early intervention we're talking about is also like part of this bill. Because if we look globally, right? If you look at like, look at Nigeria, look at the US, look at the best countries in mental health, Norway, Australia, Netherlands, look at the worst countries doing based on evidence, right? Afghanistan, Somalia, Haiti. One thing is clear from all we're saying is that when there are shocks, if you've not developed your mental health system, your mental health care system, when there are shocks, it will expose a lot of things. For example, when the COVID-19 came, we saw the gaps in the mental health service delivery in the US. And it has a connection with these other countries that are doing worse. And, Afghanistan, is unstable politically. So as trauma and depression, anxiety is increased, right? Haiti, with the earthquakes and things like that, those things, it keeps, so those shocks, even in Somalia too, those shocks expose, makes the, if you don't have a well-developed mental health care system, it makes it worse, right? Then if you have the well-developed, then you can be able to take care of those shocks. And so I think what the bill is trying to do now is to be able to say, let's focus on prevention and early intervention also, so that, shocks will always come, but how can we manage it so that, everything doesn't fall apart? So it's kind of relating that to what is happening globally. Yeah.
So I just want to add to that, there is the mental health fund that has been proposed for mental health in Nigeria. And I'm hoping that beyond just allocating that funding, it's also released for use, across different parts of the country, because that's actually a big problem sometimes with regards to healthcare initiatives. There is money allocated, but it's not released for implementation, or it's implemented, in a not equitably, right? It's just maybe certain segments of society benefit more than others. And I'm also looking at, things around regulation, so that before things get out of hand, they've put in lots of regulations around the activities of mental health service providers. Who is this person? What's their capacity to be able to provide the service, and then provide certain standards and then maybe licenses for them to be able to carry out the care, in a regulated manner, So another thing I'm actually looking out for, which has worked for other programs, healthcare programs, is how to embed community-based services in mental health in Nigeria. I mean, that's what has worked in a lot of the countries that are doing very well. So it's something that we can adopt. That would be very good, because we really have some very good community structures that we can leverage for mental health. I'm also looking at integrating mental health to already functional programs that are existing. So we have priority programs like malaria, HIV, TB. They've had like lots of funding over the years. And especially for the mental health screening part and prevention, if it's embedded in the existing care that is provided in these other interventions, then that can actually take mental health a bit forward. You know, I'm also looking at intersectoral collaboration, right? Maybe we need to work with the education sector, you know, embed a bit of mental health into our curriculums. Let children, you know, people who are going to school learn a bit about mental health and how to approach accessing care when they have mental health conditions, or at least even acknowledge the fact that they are vulnerable to having those conditions and know how to access care for them. So working with the education sector would be helpful. Working with the information sector, maybe the Ministry of Information, that can help with the publicity component, and public campaigns can also be very helpful in pushing this initiative forward. So I think also we have the national health insurance system, and we also have the private health insurance systems, especially for the corporate private sector space. We also need to find the way to incorporate mental health services in those existing structures to see also how we can move it forward. So there are lots of potentials for integration of mental health. We don't need to wait until we implement a parallel program. That may not be sustainable. We need to find ways to continually integrate it with what's already in the sector. So I think those are really areas I think would be helpful.
Okay. When we come back from break, we're going to discuss, is there a distinction between mental health and substance abuse in Nigeria? And is one more of a crisis than the other? When we return, we'll ask Adima more about that, and Udo and Alex in just a bit.
Thanks for listening to this special episode of the Discerning Elephant podcast. If you, or someone you know, is struggling with suicide or any other mental health issue, help is always available 24 hours a day by calling or texting 988, the National Mental Health Hotline in the United States. Talk to someone today.
Welcome back to Discerning Elephant. So we posed the question: is mental health, is there a distinction between mental health and substance abuse as it relates to Nigeria? What were you going to say, Udo, about that?
Well, I'll just say that, they could be interrelated, right? Substance, I think one factor we are not actually seeing, more like the elephant in the room here, is that there is also connection with poverty when it comes to substance abuse, right? And there was a BBC documentary one time where a lot of people were, taking this syrup that had codeine in it, right? And it was being pushed more in the deprived neighborhoods, the deprived areas in Nigeria. And because no jobs, no source of, livelihood. So there was a very high incidence of of that particular drug misuse, right? Of course, it definitely affected their mental health in some way. So it's like the chicken before the egg. Were you having a mental health issue before you started drug abuse, or what did drug abuse lead to the mental health? So it's that conundrum there where you can't necessarily separate the two per se, but mental health issues could also lead to drug abuse, right? And vice versa. So it's connected. But I think the major thing is there are also triggers to that, right? So if a particular environment is going through trying to cope, right? They don't have the coping and resiliency skills, and then you push some drugs in that area, there is a high tendency that they might get to use it as a way of coping with themselves. So what happened was that it later got banned everywhere, and then to be able to get those drugs, you needed the doctor's prescription, right? So I think even on the streets, it still happens, but mostly it affects the poorest, right? And you're wondering, how are they able to afford it? Well, if they know that they have to cope with it, they'll find ways, and it's connected to other things. So there are a lot of factors that we are not, perhaps because of time, we might not discuss here, but it's connected with mental health and substance abuse, where one precipitates the other, one supports the other, and there is this interaction between the two sides.
Yeah, just something to add. We had talked about the social determinants of mental health, and some of the things Udo has highlighted are actually social determinants of mental health, because all those life experiences, all the environmental factors, talking about the poverty that he mentioned, and maybe poorer neighborhoods and all of the tendencies that they have regarding certain vices might actually create an enabling environment to promote substance abuse. And then, like Udo said also, is it the chicken before the egg or egg before the chicken? Did you have mental health issues before you started using the substance to actually cope, or you started with the substance first due to environmental influences and then develop mental health after? So I think it's not specific to Nigeria. It's something that, if you look at across the world, those are facts regarding how certain social determinants of health or mental health would affect people in different areas.
Alex, from the American view, any thoughts?
Well, yeah, kind of like she said, it's not really an issue that's set in stone, and or like it could be more influential or more affluent is the word I'm looking for, more affluent in different countries, but it is something that just is around, that's plaguing in every country in the world. Like Udo said, like it affects those that are the most poverty stricken. And as somebody who worked in reentry systems within the United States for nearly a decade, at the county, state, and federal levels, and I worked with individuals releasing into society at all levels. If they really want it, they will know where to find it. Like if they want to, if they can't afford, if you have a medical, like a mental illness, and I've unfortunately had plenty of cases where they weren't able to get in or didn't have the insurance, but they turned back to their old ways of coping, which was, through the use of, heroin or methamphetamines or cocaine or any number of drugs that could help, numb the pain, I guess. But here in America, yeah, it's a big problem. People with substance use disorder are at more particular risk, to developing mental illnesses, and just the same, the inverse, individuals with a mental illness are much more likely to experience substance use disorder than those who are not affected by mental illness at all. SAMHSA, the Substance Abuse and Mental Health Services Administration in the United States, did a national survey in 2021, where they cited that approximately, I believe it was just over 9 million individuals in the United States, 9 million had a co-occurring disorder, which is where you have both a substance use disorder and a mental illness at the same time. And like you guys were saying earlier, it's a very vicious cycle. One exacerbates the other. One might use illicit substances, again, methamphetamines, cocaine, mushrooms, just to name any one of these, fentanyl, big crisis these days, to self-medicate to take care of their mental illness, but at the same time, it's feeding into substance use disorder. So here it's big. It's big here. It's big everywhere. But it's working in the fields of public health, in the various levels from, policymaker, decision maker, stakeholder to, direct service providers and practitioners that are, the ones working with these individuals to really help make a difference for them.
Nice. Well, I want to thank everybody for joining us tonight. We're super excited to get this going. But before we wrap up, I'd like to do a quick lightning speed of final thoughts. This panel is here to stay. Udo, Adima, and Alex, they are part of Discerning Elephant just as I am. You will see them again. It's not the end. I'm super excited. But before we wrap up, let's go with our final thoughts. Adima, any final thoughts on our subjects or what people need to know?
So I think working on mental health and making progress is doable across the world. We just need to prioritize it. So yeah, that's my last word.
Nice. Udo, any final thoughts?
Yeah, I think the major thing for me is trying to destigmatize mental health, basically, so that we can freely talk about it just like every other illness. And if we can freely talk about it, then more attention comes to it, and perhaps more government funding and support with policies at the same time. But I think destigmatizing it is important so people can actually dial 988 and get the help.
Yeah. Yes. Alex, final thoughts?
Other than what Adima and Udo have said already, I guess my final thought is just, as someone who worked in as a direct service provider and practitioner, working with individuals who struggled with mental illness, utilizing my own life experience to also kind of help guide that recovery and healing for individuals. Just a big thank you to all of the direct service providers, policymakers, the internal and external stakeholders, collaborators that really care about this work, whether you're a paid employee, a volunteer, or what have you. Just mental health is so prominent, and I remain happy that it's finally a national conversation, but I remain hopeful that it will continue to be, in that, the US, Nigeria, things that we've, seen in these two countries release in the last, year. I'm hoping that these are here to stay, and that both of these countries can be leading examples around the, to, help improve global mental health.
Thank you. And my final thoughts is simply this: dial 988. Get your people to know what 988 is about. We need to make sure we spread the word. Let's save our humanity. We have these things for a reason, so let's actually utilize these tools to its maximum proficiency. We look forward to seeing you again. And to everyone, good night. See you on the other side. Discerning Elephant. Bye.